The clinical practice issue selected is the effect of sequential compression devices on deep vein thrombosis prevention. Our clinical floor was at 5 Northwest at UCMC, which is an orthopedic trauma unit, and tend to have patients who come in from motor vehicle crashes or gunshot wounds.
Our clinical practice issue is extremely important to both nurses and patients. DVTs occur when blood clots form in larger, deeper veins of the body. A clot, or thrombus, in a deep vein could break off the wall of the blood vessel and travel through the blood supply as an embolism, end up blocking the flow to the lungs, known as a pulmonary embolism. These clots prevent the flow of blood through the lungs, preventing gas exchange from occurring, which is why oxygen deprivation and eventual tissue damage follow DVTs. The damage can be life-altering or even life-threatening to patients. Nurses should realize that implementing sequential compression devices is important and allows the care provided to be patient-centered and holistic.
The PICO question developed for our floor is, in the patient population of 5 Northwest at UCMC for orthopedic trauma patients, how does the use of sequential compression devices and anticoagulant medications compared to no intervention prevent the formation of deep vein thrombosis? To develop our PICO question, we looked at safety and risk management and concerns and evidence validation for current practice. Current practice involves the implementation of SCDs along with administration of anticoagulant medication.
Some sources used for this paper came from the Shaull library with full text and the Cochrane library. Keywords searched include deep vein thrombosis, compression devices, anticoagulants, and mechanical prophylaxis. Some of the research limitations for our paper were that all of our articles were peer-reviewed as well as they were all originally authored in English.
Article 1 was a systematic review of a combination of randomized controlled trials and quasi-experimental studies. This is a Level 2 good quality article that looked at 22 trials and a total of 9,137 patients. The population used was post-surgical patients of various types of surgeries. The study found that a combination of the compression devices and the prophylactic medication had a lower rate of DVTs than the compression devices alone, but no difference in incidence when compared to medication alone. It also found that all surgeries had the same risk for DVT development.
The second article reviewed was titled Graduated Compression Stockings for Prevention of Deep Vein Thrombosis. The article was a systematic review of a number of different randomized control trials, making it a Level 1 and a high-quality article. Key findings that were found in this study that relate to our PICO question include a treatment group of 1,391 patients, and 126 of those patients develop a DVT, which equates to 9%. However, the control group, which didn't have graduated compression stockings, of 1,354 patients had 282 of those patients develop a DVT, equating to a much higher percentage of 21%. The results were statistically significant and can be shared and generalized to other research.
This article is a comparison study between two different types of mechanical prophylaxis, a thigh-calf low-pressure sequential compression device and a calf-foot high-pressure pulsating compression pump. DVTs developed in 19% of the thigh-calf low-pressure sequential compression device group, 13% of them having a large occlusive clot, and 2% of them having a documented pulmonary embolism. DVTs developed in 9% of the calf-foot high-pressure pulsating compression pumps group, with 4% having a large and occlusive clot and 0% having a documented pulmonary embolism. While there was a trend in the data with patients receiving the calf-foot high-pressure pulsating compression pump prophylactic measure tended to get less DVTs than the patients receiving a thigh-calf-foot low-pressure sequential compression device, the difference was not significant, with a p-score of 0.16.
The fourth article was a randomized clinical trial that analyzed both the effectiveness and the comfort of 3 different types of graduated compression stockings: knee length with low pressure, thigh length with low pressure, and knee length with moderate pressure. This study strove to examine patient comfort with graduated compression stockings, which promotes patient compliance with post-op GCS usage. This study analyzed 219 patients from the general surgery, gynecology and obstetrics, and urology units at a research hospital. Along with the mechanical prophylaxis intervention of the GCS, patients were given an anticoagulant drug subcutaneously daily and early post-op mobilization ankle exercises to prevent DVT development. By the end of the study, none of the patients had developed any DVTs. The problem experienced by the patients were related to comfort. The efficacies of knee length and thigh length GCS were reported to be similar. Patients found a low pressure GCS to be most comfortable. This study was a quantitative study with a level 1 quality A evidence.
The fifth article used was thromboprophylaxis for trauma patients. It was a level 1 high-quality article using quantitative research and was a systematic review containing 16 studies that were all random controlled trials. They looked at the effect of prophylaxis effectiveness to prevent DVTs, mechanical prophylaxis effectiveness to prevent DVTs, and pharmacological prophylaxis to prevent DVTs. The type of participants used were trauma patients of any age. Reviewing the results showed that there is no evidence to prove that thromboprophylaxis helped prevent mortality or pulmonary embolism, but does show evidence that they help prevent the formation of DVTs. Pharmacological prophylaxis, such as anticoagulants, was more effective than mechanical prophylaxis, such as sequential compression devices.
The sixth article we reviewed was the effects of compression devices on preventing deep vein thrombosis among adult trauma patients. The article was a systematic review composed of 5 randomized trials with a total of 1,072 patients, making it a level 1 high-quality article. The aim of this study was to review the effects of compression devices preventing DVTs among adult trauma patients. The incidence of DVTs in the control group was 11.3%, while in the experimental group was 4%. In the control group, 9 patients had DVTs while 3 patients had DVT and PE. The difference was statistically significant, concluding that there is evidence that sequential compression devices reduce the incidence of DVTs in trauma patients, and the SCDs were more effective than no prophylaxis.
Due to the evidence gathered in our evidence-based practice project, we have determined that the current hospital practice of using sequential compression devices to prevent DVT of immobile patients should remain in place.